Okay, so it is 8 o'clock on the floor. We're gonna do our regular med rotations for the morning. We're gonna start off with Joe Milton. So the first thing I'm gonna do is I'm gonna clean my workspace. Okay, so I clean my workspace. Then I'm gonna clean my hand sanitizer. Okay, that's good. So now I'm gonna make sure I have my equipment. So I have my MAR here. I'm gonna have a little med cup, and I have my drawer of medications right here. Okay, so I have all my equipment. So now I'm gonna do the 7 rights. So the right client, we have Joe Milton. I'm gonna check his hospital bracelet before I administer, make sure he's the right client. Right medication. So his 8 o'clock meds say he needs risperidone 2 milligrams. So we'll make sure we have risperidone 2 milligrams. He'll be getting 1 tablet, so 2 milligram tablets. Right dose, again, 2 milligrams, 1 tablet. Right route, it says orally morning and evening, so he'll be getting his an oral tablet. Right route, right time. So he gets risperidone orally morning and evening, and it's 8 o'clock in the morning, so it's the right time. Right reason, it's his regular prescribed medication every day, so it's the right reason. And right documentation will leave until the end after I've administered. Okay, so I'm gonna do my first check. So I grab my risperidone. So we have risperidone here, 2 milligram tablets, 2 milligram tablets. So we'll be getting 1 of these. Okay, so I have my med cup. I have everything I need. I'm gonna do my second check before I dispense it. So risperidone 2 milligram tablets, risperidone 2 milligrams. So he'll be getting them. Okay, so now I'm gonna put it into the lid. Make sure I only have 1, so everything's right. Good, okay. And before I put it away, I'm gonna do my third and final check. Risperidone 2 milligrams, Joe Milton, risperidone 2 milligrams, 1 tablet, 1 tablet. Put that away. Good, okay, so now we're gonna go to Joe. All right, good morning, how are you?
Good morning, fine, thanks.
So can you tell me your name?
Joe Milton,
And when's your birthday, Joe?
July 15th, 1963.
Perfect. Can I just look at your hospital band? Perfect. So he's the right client. This is Joe. Here's your morning medication.
Thank you.
Watched him take it. Perfect. Okay, so we'll dispense of this. Awesome. And again, I'm gonna wash my hands, hand sanitizer. And I'm gonna go and I'm gonna initial that I've administered his 8 a.m. meds. Perfect. Okay, so it's a little bit later in the day and Joe has been expressing some agitation. We talked it through. He says that he would like something to calm him down, so we're gonna give him a PRN. So I'll go to his PRN sheet. Okay, so again, I'm gonna start over. I'm gonna start with a clean workspace. All clean again, clean hands, clean. So now I'm gonna grab all of my equipment. So I'll need, this is all brand new in the package, sterile equipment. I have my syringe, the needle. I'm gonna be using a blunt-filled needle. And I have my vial that I'm gonna check. And the Band-Aid and the MAR. Okay, good. So we have everything we need. No, don't. I have an alcohol swab too. Have my alcohol swab. Okay, awesome. So now we're gonna go through the 7 rights again. Right client, we have Joe Milton. Again, I'll check his hospital band. Right medication. So he's prescribed haloperidol or Haldol. It's a 5 milligram per mil concentration. And he's gonna be getting 2.5 milligrams every 4 to 8 hours for agitation. Okay, so it's right med. Again, right dose, 2.5 milligrams. So I'll be giving him half a mil. I'll do the calculation now and another later. Right route, so he's gonna be getting an IM injection. So I have all the equipment for his intramuscular injection. Right time, so this is a PRN, so he's gonna take it as needed. He's been expressing some agitation, so it's needed. And I noticed he can have it every 48 hours, like I said, and he hasn't had any today, so he's good for the day. He hasn't exceeded 20 milligrams, so he's good. Right reason, again, we know haloperidol is for agitation, so it's prescribed for, and he is feeling agitated, so it's the right reason. And again, documentation we'll do at the very end after I've administered. Okay, so let's do the first check. So I'm gonna grab my vial, and I have haloperidol here, which is what I need, haloperidol. So I need 5 milligrams per mil concentration, and that's what I have. So I need 2.5 milligrams. So I'm gonna give him half a mil of haloperidol. Okay, so I did my first check. So now what I'm gonna do is I'm gonna clean my vial with my alcohol swab. Okay, clean, clean, clean. Good, I'm gonna keep a new one handy. And next I'm gonna open my sterile equipment that hasn't been opened before. And I'm gonna make sure not to break sterility. So I'll open it up. Okay, got my syringe. That, and I got my blunt filled. That is gonna sterile. Okay, good. So now I'm going to connect my sterile syringe to my sterile blunt filled. Okay, so now I need to draw up half a mil of air. That's our dose, half a mil. So I'll draw that up. A little wonky. Okay, perfect. So before I draw it up again, I'm gonna do my second check. So haloperidol, 5 milligrams per mil. We need 2.5 milligrams. This got the right one. Okay, so I'm gonna put it directly in. Inject the air. Okay, I'm gonna tip it upside down. And I'm going to not get any air bubbles. We'll draw just a little bit. Good. Okay. And I'm gonna make sure I don't have any air bubbles. Okay, good. So while maintaining sterility, I'm gonna keep this back on. And I'm just gonna make sure that I have the right dose, and I do. Okay, so I'm gonna give this to you. Could you show the dose? Concentrate on that number there.
Is there an actual number or just the...
Here, I can do it.
I got it.
You got it?
Yeah.
I'll just try it one more time, just in case. There's a number there. Okay. It's kind of faded, but yeah. Okay, thanks. Okay, so that's good. I'm gonna take this blunt filled off. This is gonna go into the sharps container. And I'm going to switch it to the proper needle size. So we have while maintaining sterility. Okay, so we can use, for an IM injection, we can use a 22 to a 25 gauge. I have 25 gauge, so I have. So that's good. And I do have a 5/8 size. I'd prefer an inch, but again, this will do. Okay, so before I go over to Joe, I'm going to do my last and final check. So we have haloperidol, 5 milligrams per mil, haloperidol, 5 milligrams per mil. So he needs 2.5 milligrams. So that means I'm giving him half a mil. And I have half a mil. Perfect. Okay, so I'm gonna grab my gloves. I don't have any sharps out. I'm gonna grab my alcohol swab, and we're gonna go over to Joe. Hello, how are you?
I'm good, thanks.
Good. What's your name?
Joe Melton,
When's your birthday, Joe?
July 15th, 1963.
Perfect. Can I take a look at your bracelet? Awesome. So we're good. We have the right client. Okay, Joe. So I just have your your PRN here. It's gonna help calm you down. Is there, do you have an arm that you would prefer to use?
My right.
Your right arm? Okay, perfect. So we're gonna set that down there. We're gonna take our alcohol swab. Good. And I'm gonna put on my gloves. Good to go. Okay, so for the landmarking for this one, I'm gonna find the chromium process right about there. And we're gonna go about 1 to 2 inches, 3 finger widths down. And I'm just gonna make a V. And we're gonna go right in there. So I'm gonna use my non-dominant hand to Z track to kind of pull the skin a little bit. Okay, Joe, so I'm gonna put it in now. Are you ready?
Yes.
Okay, so I'm gonna pull and I'm gonna put it in at a 90-degree angle, kind of like a dart-like. So I'm gonna put it in, good. So now I'm gonna stabilize and I'm just gonna gently aspirate to make sure that no blood comes back. So we're good, there's no blood, we're in the muscle, perfect. So we're gonna slowly inject. Good. And we're gonna come back out, same way we came in. Look at the little mark there. Perfect, and if he was bleeding, I have a Band-Aid, I could put it on. I'd apply gentle pressure, I wouldn't rub. You're not bleeding, that's perfect. How was that?
Good, thanks.
Good, okay, is there anything else I can get you?
No.
Okay, I'll come check on you in a little bit.
Thank you.
Okay, so I wouldn't recap the used needle. I am gonna put it straight into the sharps container. I'm gonna wash my hands. Good, and I'm gonna document. So it's about 6 o'clock. 6 o'clock, and initial. Okay, perfect. So I did my 7th right documentation. So that's all done. My sharps are put away. Okay, so now I'm gonna finish off with the landmarking. Yes, so I showed the deltoid. So I'll just get you to lay on your side. Whichever side you prefer, we're gonna do her right side. So we're gonna do the ventrogluteal. This is the preferred practice site. Excuse me. So I'm gonna find the greater trochanter. You see me? Okay, so I'm gonna find the greater trochanter. Okay, and I'm gonna find the iliac spine, the iliac crest. I'm gonna rest my finger. Good. And I'm gonna spread out my fingers like this. Can you see? Okay, and I'm gonna go right in between, right in there. So again, that's our preferred site. Okay, so now I'll show you vastus lateralis next. So again, we're gonna use the greater trochanter, and we're gonna use the patella, and we're gonna divide the thigh into 3 main sections. So again, 3 sections. Can you see? Okay, 3 sections, and we're gonna go right in the middle, right in there. Okay, so we'll do rectus femoris next. So I'll get you to go on your back. Awesome. Okay, so again, we're gonna use the greater trochanter and the patella. And again, same way, we're gonna divide it up into 3 sections, and we're going to go right in the middle, just a little distal, just right there. Okay, and the last one we're gonna do is the dorsogluteal. So if I could get you to go on your stomach. Okay, so I'm gonna show the 2 different ways to do this. So you're gonna find the iliac crest up here and the bottom of the butt cheek. And then the first one, I'm gonna divide the butt into 4 quadrants, like that. And then in the upper quadrant, I'm gonna divide that into another 4. Okay, and then I'm gonna take the top corner right in there. That's where I'm gonna do it. And the other one, the other way you could do it, I'm gonna again find the greater trochanter and the iliac crest, and I'm just gonna draw a line from the crest to the trochanter. And then I'm gonna go right in the middle, and from there I'll go about 1 inch up. So go right in there. Okay, so I got them all, and that is it.